Inspires Me, a show about wellness, amazing people, and information to inspire you to take charge of your life and your health. My next guest I discovered when I was researching the topic of lifestyle medicine. After the death of my father and my subsequent realization that my health issues were being caused by my lifestyle and my father's lifestyle, I came across Dr. David Katz, a preventive medicine specialist and a global recognized authority on lifestyle medicine. He's the founding director of Yale Griffin Preventative Research Center, past president of the American College of Lifestyle Medicine, president and founder of the True Health Initiative, and also founder and CEO of DietID. Katz is a fellow of the American College of Preventive Medicine, American College of Physicians, American College of Lifestyle Medicine, and Morse College, Yale University. He has his MD from Albert Einstein College of Medicine and a Master of Public Health, Yale University Public Health. He also is board certified both in preventive medicine and public health. He's recipient of numerous awards for teaching, writing, contributions to public health. He is also the 2019 nominee for the James Beard Foundation of Health and Journalism. He holds many honorary doctorates and has published hundreds of online newspaper columns, co-authored 18 books to date, and hopefully we'll be talking about 2 of those today. He's been recognized by his colleagues as the Poet Laureate of Health Promotion. He's a keynote address, done keynote addresses in all 50 states and in countries all across 6 continents. This guy is a rock star. And Dr. Katz, it's my distinct pleasure to welcome to Mike Inspires Me.
Oh, thanks, Mike. And you do inspire me, and I'm glad to be with you. I appreciate the opportunity.
Thanks a lot. Hey, I tell you, it's getting crazy out there as we were just talking, this coronavirus thing. Hey, there's one upside I see to starting to shut down these restaurants. People aren't going to be running out to get that KFC donut chicken sandwich anytime soon.
There's that. And honestly, I guess the other upside is as the world's economy unravels, our production of carbon emissions has gone down dramatically. I mean, we've achieved inadvertently what no level of political activism was able to achieve. That's interesting. Yeah, it's a mess, Mike, and whatever else we might like to talk about, I think we have to start there because it's what's on everybody's minds.
Right.
So for starters, what I can say, as my relevant expertise is as a board certified specialist in preventive medicine, public health, trained in epidemiology, written textbooks on the topic. That doesn't mean I know exactly what we all need to do. And frankly,
Right.
If anybody tells you they do, run the other way because they're wrong. It's a pretty unprecedented situation. We're all trying to learn as much as we can in real time and stay light on our feet. There is stuff I can tell you though, and I think it makes a difference. The first is we have the best data on level of infection, level of severe infection, and mortality or death risk from South Korea, which has tested pretty much the whole population. Nobody else has done that. We haven't come close in the United States. They certainly haven't done it in Italy. And so the best available data from around the world suggests that 99% of all coronavirus infections are mild. So no need for hospital care. In some cases, it's extremely mild, like a bad cold. In some cases, it may even be completely asymptomatic. You may have it and never know.
Okay.
But in some cases, it's unpleasant. But, like a bout of the flu, you stay home, you eat chicken soup, you get over it. 99% of cases. Even that's misleading, Mike, because the severe cases and the mortality risk are massively concentrated in people over 60, but mostly over 70, and much more so over 80. In other words, the very population that is most at risk to die from anything, because that's what happens when we get old enough, is most at risk for dying from coronavirus. And so what that means is most of us are at very low risk of life-threatening infection, very low risk. And children seem to be at zero risk. There are no documented deaths among children to date anywhere in the world, which is great news because the flu, it kills young children just as it kills older people. So massively concentrated risk among chronically ill, immunocompromised, and the elderly. And, for the most part, the rest of us are probably somewhere near 99.9% chances, if we get this thing, of having a fairly uneventful recovery. That's really important reality check. The other thing that I think people need to consider is if you were getting constant 24/7 news reporting on every death from, almost any other prevalent condition, you could be freaking out about that, especially if we gave it a new and exotic name, COVID-19. So if we called heart disease, HD20, right? Heart disease 2020, which is called HD20. There's a massive epidemic, and actually in the United States alone, more than 500,000 people are killed from this thing every year. And so, 1,800 people a day. I mean, we would just freak out if every time there was another death from heart disease, it was reported as an event. And so, yes, this is serious. Yes, this is a big deal. Yes, none of us has seen anything like this in our lifetime. But the reality is greater risks to the general population, to our loved ones, hide in plain sight all the time. And because they're familiar, because we sort of, we're habituated to them, they don't freak us out. But if we actually, if we gave them a shiny new name, pretended they were exotic, and followed every single death, they would freak us out. They're vastly more common than the risk of coronavirus. So to some extent, I want people to, kind of take a deep breath and calm down a little bit. I think we should all be focusing on doing all we can to keep our frail elderly loved ones away from potential exposure. I think we do need help from the public health system to do that, but there's a lot we can do as families. So, we should not be gathering grandparents with all these college kids that were just sent home, right? Because, if they're coming home from Chicago, New York, LA, Boston, they could have been exposed, and the last people we want to expose are their grandparents. So honestly, I think we should be practicing what I call vertical interdiction, which is, within small social groups, how do we isolate, shelter, protect the most vulnerable? And to be honest, these large social gatherings, I'm not sure we have to disrupt them all for young, healthy working people, for young students, because it looks like they are prone for the most part to mild infection. For people who want more of what I have to say based on the data, I publish all of this on my LinkedIn profile. I'm pretty easy to find on social media. But the easiest thing, Mike, would be to go to davidkatzmd.com, my website. You'll see my social media links there. You can just click on them, and all these columns that I'm writing on my blog platform to kind of share what are the data, what do they mean, who's at risk, who's not, which portion of our anxiety is justified, and which portion is what I call risk distortion because we're paying such constant attention to this thing.
Yeah. And, you brought up a good point early on with the mild symptoms. It's funny, I don't know, several weeks ago, I think it was the day that Kobe Bryant died, I had some symptoms that I didn't understand were going on. It was like a mild fever. I had a cough, slight, just very slight, but I was out hiking, and I was, but I'm in generally good health for my age. And I didn't think much of it. In fact, I thought it was because I was taking a candida cleanse, which I probably shouldn't be doing, but I was taking, and there are symptoms, from that as well, as I'm sure with the candida die-off. And so I kind of assumed it was that. And then I was listening to my stepson talk last night, and around the same time period, within a few weeks, they were having their own similar symptoms to what I had, and all sounding similar to what may have been. We don't know, not going to assume, but it's a point in case we're walking around and we may not know, and it could be larger than what we think, but the effects are not as, to ourselves, not as bad, but it's the more, like you said, the elderly population, the folks who have compromised immunities, those type of people we got.
Yeah, but again, so if you had fever and a dry cough and it went on for a while, and then other members of the household with exposure had the same symptoms, that absolutely could be coronavirus. And there, if you did or if you didn't, there are a lot of other people like you out there, same thing, may have had it, didn't know. But we need to be, so there's a lot we can do, both to sort of keep calm, carry on, protect our most vulnerable loved ones. But we really do need help from the public health system. So it should be easy for you to get tested. You should stay away from clinics and hospitals. There should be mobile testing units. There should be places to go get tested where you're not exposing other people in every community. if we had a robust public health response, all of that would be going on.
Right.
One of the important messages about the now is that we perennially underfund public health in this country and then regret it like hell when there's a calamity.
Right.
So we really, we need to be more proactive. This is a vivid illustration of how important it is to have those kinds of resources. Just imagine if we could have very expeditiously set up mobile testing and set up, community test points, and anybody with these symptoms, don't go to the doctor, don't go to the hospital. Last thing you want to do is, if you do have this, expose, the vulnerable people there. Right. And if you don't have it, you don't want to congregate with people there and get it. So we've got these testing places that will keep you isolated from large crowds. We can process this very efficiently.
Right.
We'll know whether or not you have it. If you don't, you get the all clear. If you do, you'll get instructions about self-quarantine, and that will curtail transmission to vulnerable people, and on and on it goes. We should be doing all this, and there's nothing you can do as an individual to compensate for deficits in a public health system. So there's a lot we can do as individuals. I think that is important, but we can't pretend we are the same as a robust public health system. And the best response involves both good, thoughtful individual practice and a robust public health system.
That's great. Yeah, no, the interesting thing in the case of what I was talking about, we actually all live separately and rarely have contact too, but live in the same town. So we all live there. Yeah. Okay. Well, no, it sounds like, that was a lot of great information. You've given people, folks where to go. So, the other thing leading up into, kind of taking care of our health, you've come out with a number of books recently, and within the past year, The Truth About Food, why pandas eat bamboo and people get bamboozled. I see you smiling about that title. I tell you, I've started to get through that book and reading a lot of the truths that are out there. You have to create a book like this because, let's face it, there are a lot of myths out there, whether it's diets, whether it's what the food industry is leading us to believe. They're not in the business of selling nutrition. They're in the business of selling product.
Yep, absolutely. Yeah. So thanks, Mike. So the truth about food is a brain dump for me. And the idea was, I've spent 30 years, I've been a physician taking care of patients for 25 years, ran the Prevention Research Center at Yale for over 20 years. I've been a clinical researcher. And I've learned a lot, and as a scientist trained in these methods, I've run randomized controlled trials and published them. I've run meta-analyses and published them. So, I'm very well versed to know not just what's true, but why. What kind of information makes something valid and reliable, and what are the telltale signs that something is just out for your credit card. So, what I did in The Truth About Food is I decided I'm going to, first of all, to relieve my own burdened mind, I'm going to put everything I know, not just about what I know, but about how and why I know it, in one place. Right. And my goal with this is I want to immunize people, not just against the last fad diet, because we know what that one is already. I want to immunize them against the next fad diet, because who knows what that one's going to be. And you can't do that by giving people, specific warning about don't believe blank, because we haven't filled in the blank yet. What you have to do is help people have a robust understanding of how can you know what's true about nutrition? How can you tell if a study is important? How can you know who to trust? One of the important messages about diet is that, the biggest news about diet is there is no news about diet. You think about, for example, the blue zones, the places where people most routinely live the longest and have the best health. There are no fad diets. They eat the way they've been eating for generations. Right. Nobody's waiting to hear what's the right diet this week. And in every place around the world where people are waiting to hear what's the right diet this week, their diets are terrible and their health is pretty bad to boot. In the United States, where we're always waiting to hear what is the best diet this week, diet is the single leading cause of premature death. And it's a way of tying this conversation in to the conversation about coronavirus. So everybody's freaking out and fixated on coronavirus, which, so far has killed 70 some odd people in the United States. Diet kills several 100,000 prematurely every year. And the thing about diet that's very different from coronavirus is coronavirus, you get sick, you get over it, you either die or you don't, and very few people relative to those infected do die. Whereas diet, when it doesn't kill you, it still hurts you. Bad diet causes diabetes, it causes heart disease. Right? It may not take years from your life right now, but it will take life from your years, and it does that even to children. So massive burden of bad diet. And yes, we absolutely do know what a good diet is. And so, in
Right.
order to get from here to there, people really do need to understand what is the truth about food. And then, the subtitle, why pandas eat bamboo, people get bamboozled. I was making the point that
Yeah,
every kind of wild animal knows what to eat. It's
exactly.
not like you have to run randomized controlled trials to know what to eat. You just have to eat in accord with your native adaptations, which takes us in a direction of, real food.
Right.
Michael Pollan put it beautifully in 7 words: eat food, not too much, mostly plants.
Love that.
I mean, the truth is really quite simple and
Yeah.
hides in plain sight. But getting past the lies, the deceptions of big food, the
Right.
deceptions of big pharma, the deceptions of big media, big publishing, the idea that there is a change in everything we know each time a new study comes out and the media hype it, all of that needs to be fixed in order for us to be able to access the simple truth. And so a lot of the book is about debunking the myths and lies so that people can find their way to the truth.
Well, you think about it too, interesting, cigarettes have a warning on them and people know, okay, they'll still smoke them, but even with the warning, they know. And if we put a similar on food, which is it going to change anything?
Well, I don't know if it is or
Yeah.
not,
Yeah.
but it's certainly warranted. There are definitely foods that should come with a skull and crossbone symbol, as far as I'm concerned. But I mean, people ought to know that the truth is the truth, and
Right.
shouldn't have the perception that no two experts disagree. That's the other thing to say about the truth about food. So the proceeds from that book all go to the True Health Initiative. It's a 501c3 nonprofit I created. People can learn more about it at truehealthinitiative.org. And the important thing about that is that the council of directors that provides the True Health Initiative its direction is about 500 world-leading experts in multiple public health disciplines from 45 countries, and with dietary preferences and practices ranging from paleo to vegan, but all coming together to say, we agree about the fundamental truths. We agree people would be better off eating whole food, mostly plants, in a sensible, balanced assembly. We agree that people don't need a new diet coming out every week. We agree that each study that comes out and gets hyped by the media doesn't change everything we knew up until yesterday. Science doesn't work that way.
Hmm.
It's disrespectful of science to treat it like a ping pong ball. It's this, it's that, it's
Oh,
this, it's
yeah.
that. The way science works, it's a gradual, hard-earned aggregation of understanding. You have to take every new study, add it to what you knew up until this morning, interpret it in context, and ask, does this meaningfully alter what we thought we knew based on the massive evidence we've accumulated up until now? And the answer most of the time is no. And when the answer is yes, it's usually a very incremental adjustment. This notion that everything changes with every news cycle is just silly. So anyway, that's the 750-page behemoth, The Truth About
Oh,
Food, and all proceeds from that book go to support the True Health Initiative.
yeah, and guys, you can find it anywhere out there. It's on Amazon and a whole bunch of other outlets for selling books. So check it out. And then the latest, this one, How to Eat. And all your food and diet questions answered. Why would we have to ask how to eat? Isn't it simple? You just open your mouth and you grab something.
Well, that would be true
and you put it in.
If there's something were food. Sadly, in our culture, there's something is likely to be some ultra processed frankenfood that you really you ought not to eat. So
like a donut sandwich, right?
Exactly, all that nonsense. So so this book, this is the easier read. So I would say, Truth About Food, it's more of a reference book. Again, 750 pages. How to Eat, that's my latest, co-authored with Mark Bittman, whose name many people will know, famous food nutrition writer for the New York Times for many years, knows a lot about agriculture and food production and food systems. And what happened here, Mike, is that Mark and I got together, got to know one another. We became sort of pen pals, exchanging ideas. And eventually we decided we wanted to do some writing together. We worked up a column, shared it with Grub Street and New York Magazine, where Mark had a gig. And they loved it, and they took it, and they ran it, and they published it as the last conversation you'll ever need to have about diet and health. And it kind of went viral, which I guess is something I hesitate to say in the midst of the coronavirus craziness, but it went viral. It was one of the most popular pieces New York Magazine had ever published. And so inevitably, because of that, they said, okay, so it wasn't the last conversation. We want to do a sequel. It was the second to last conversation. So we did another one, and that was also very popular. And both of these columns were of a Q&A structure where, Mark and I were basically just sort of, kicking around answers to a lot of what about this and what about yogurt and what about coffee and what about eggs and what about dairy and how much of this should I eat and are lectins okay and is gluten safe, and we just answered them all. And it was fun and cheeky and engaging. You know, how many yogurts should I eat every day? How the hell should we know? I mean, you know, and how many are you eating now?
Right.
So, you know, when we couldn't answer a question because it was absurd, we said, we can't answer that question. But, you know, for the most part, we answered and we got into the details. But these were just, you know, these were columns. They were long columns, but they're still just columns. And, you know, when it was done, we said, well, you know, there's a lot more to say. This is a book. So we went together to Mark's publisher and said, you know, we think we could do a whole book version of this. And they said, absolutely. And that's what happened. We literally got together and kind of sequestered ourselves in a nice farm where Mark lives in New York, Linwood. Yeah. And, you know, for several days, we recorded our conversation, you know, what about this and what about that? And by the time we were done, 3 days later, Mark cooked, by the way.
Yeah. Okay.
I mean, you know, he's famously the author of How to Cook Everything.
Exactly.
Great cook. But, you know, several days later, we had like 150,000 words recorded, and then we got it transcribed, and then we carved it up and trimmed it. And we had great editing from our editors at Houghton Mifflin Harcourt. And so the result is it's a lean book. You just held it up, and you know it's unlike The Truth About Food, which is a great doorstop. This one would not be in a stiff wind. It's a little book. Yeah, it's fun. It's easy to read. It is, however, really detailed and comprehensive. We provide relevant scientific references. We get into, you know, a lot of it's at a very high level about diets and dietary patterns. What about keto and what about intermittent fasting and all that. Right. But we get into the particulars. What about dairy? What about butter? What about milk? What about yogurt? What about cheese? What about eggs? What about fish? What about meat? What about processed meat? What about grass-fed meat? You know, all that's in there. So really comprehensive, but easy to engage with. And this one is in bookstores everywhere right now, assuming anybody's still going to bookstores. But it's also available all the usual places online.
Exactly. So that's great. You know, it's funny, tying back to what you said about animals. We are the only species that has to say,
I mean, domestic animals don't know because, you know,
right.
But yeah, right. Every wild species eats what it should. I mean, you know, they interact with natural food and they choose what they're adapted to. So you don't have to talk lions out of eating grass. They're carnivores, they eat meat, and you don't have to talk wildebeest into eating grass. They're herbivores, and that's what they do. So, you know, I mean, to some extent, and I say this again as a career scientist, we've sort of weaponized science and are turning it against understanding. We're almost talking people into the notion that, you know, unless you've done the right kind of randomized controlled trial, you can't possibly know what you already know. But that's just silly. I mean, as a parent, I've raised 5 kids. I can be quite confident that I was right. They should not run with scissors, despite the want of randomized controlled trials and meta-analyses on the topic. You know, some stuff is just obvious, right? It hides in plain sight.
Yep. That's fantastic. I love it. And I'm looking forward to finish. I just got it last week. My niece got me the book and it's awesome.
That's great. Thanks.
Well, hey, so as I mentioned in the intro here, so you've got a couple of companies that you're involved with, and you've got this one here, DietID, that I'm kind of interested in. So why don't we talk a little bit about what you're doing there and some of your current initiatives and work?
Yeah, so I actually left Yale after 30 years in my various roles there to run DietID. So it's my primary vocation now. We're a startup company that has completely revolutionized dietary assessment. So we can produce, with a digital interface that's image-based, so you can do this from home, a complete assessment of your diet, your dietary pattern, an objective measure of your diet quality, estimates of up to 150 nutrient levels in about 30 seconds, maybe 60 if you're slow. And we can use this same real innovation in method to help you identify a personalized goal diet. We can provide digital coaching from here to there. Now, I say this, I hasten to note we are what's called a B2B business. Yep. In other words, we license to businesses. So we would want to license to health coaches and health professionals and health systems and all of that. But, you know, your gym could license us and your health coaches could license us. So if you're interested, you know, you could pass the word along. We actually have some relevance, Mike, in the midst of the coronavirus craziness, because, you know, I've a lot of people have been asking me, what nutrients are going to help my immune system, what foods are going to help my immune system. And
Sure.
really the best way to answer that is not a one size fits all answer,
Exactly.
but to actually know, well, what is your diet and what are the nutrient gaps and what are the things you need to fix with the DietID assessment, which again, it's easy, it's fun. You don't have to remember details of what you ate. We take care of that for you using images. The best analogy is like a trip to the eye doctor where you look through that device and they say, okay, here are two images, one's clear, one's blurry, which is which? And you say A is clear and they say, how about now? And you say A is clear and they say, how about now? And you say, now B is clear. Well, we've done that for diet. We've created this library of representative images of different kinds of diets at different levels of quality, all fully analyzed. We show you two at a time and say, which looks more like stuff you eat? You say that one, we say, how about now? You say this one, we say, how about now? It's really fun. So people can learn more at dietid.com, but this method would allow us, again, in under a minute to say, okay, so here's the quality of your current diet. Here are foods you're deficient in that you should prioritize. Here are nutrients you're deficient in. And if you want to fix that immediately, that could be done with supplementation, but rather than a one size fits all, targeting exactly what's deficient in your diet. So it is relevant to kind of, the immediacy of the current situation.
Right.
But over time, it's just fundamentally important to making diet the vital sign it deserves to be. Diet is the single leading predictor of all-cause mortality, total chronic disease risk in our country. So, long after the coronavirus craziness has faded, we're still going to need to pay attention to that.
Yeah. And that's kind of, I love that you mentioned that, because that's what led me to finding you in the first place, was realizing that it was stuff I was putting in my mouth. In my father's case, cigarettes. Yeah. That was leading towards my inevitable death.
And that has been for decades the short list. Feet, forks, and fingers, I call it. Physical activity, that's feet. Forks is dietary pattern. Fingers is don't use them to bring cigarettes to your mouth. And if we didn't smoke, were routinely physically active, and ate an optimal diet, 80% of all major chronic disease could go away just with that. So 80% less heart disease, cancer, stroke, diabetes, dementia. That's incredible. It is
incredible. It blows my mind. Yeah.
Yeah. And again, these acute crises that make us so acutely concerned about our health risk should also point out, well, then maybe what I can do to protect my health the rest of the time is important too, right? Because we have this massive opportunity to protect ourselves and those we love from all of those terrible diseases. Right. With better use of feet, forks, and fingers, and far too few of us take advantage of it. So yeah, definitely don't smoke. That's a fairly obvious one. And if you do, get help to quit. Be physically active. And yes, the value in optimizing diet cannot be overstated. Diet quality is the single leading predictor variable for all-cause mortality, premature death, total chronic disease risk in the United States today, full stop.
That's great. And I love it. Amen to that. And I that's exactly why guys like us need to get out more, help bring out awareness for these things. And I think that's really the only way we're going to create change.
It's exactly right. And so I appreciate you, because that's just what you're doing. And you're giving me an opportunity to preach the gospel. And I very much appreciate it. Yeah,
I'm with you there, my brother. All right. Well, we've mentioned a number of your websites. So maybe we could just recap real quick for our folks that want to follow you and possibly get involved in any ways.
That's great. Thank you, Mike. So the easiest, if you're going to remember just one, would be davidkatzmd.com. That's my personal site, and it's a portal to everything else. So you'll find my books there. You'll find my online columns there. There'll be links there to my business, and there'll be links to the True Health Initiative. If you want to go directly to those others, the latest book is How to Eat with co-author Mark Bittman, easy to find online. And then the two other sites, so my business, DietID, is dietid.com, and the True Health Initiative, truehealthinitiative.org.
Fantastic. Dr. Katz, real pleasure. Thank you so much. This has been a great time. We probably could have talked more and more, and hey, maybe we'll do a future one. But thanks again.
It'd be a pleasure to come back. You take good care.
Yep, you too.
Bye-bye now.